I, hi, everyone. I want to welcome you. My name is Marianne Frangoulis, and I am the director of the Massachusetts Organization for Addiction Recovery, known as MORE. MORE is an organization led by and for people in addiction recovery. I am looking forward to being your moderator today as we continue this webinar series, How Much is Too Much? This series is a collaborated effort of AARP Massachusetts, the Massachusetts Organization for Addiction Recovery, and the Older Adult Behavioral Health Network at MAMH. Special thanks to our planning committee, Kara Cohen from AARP, and along with me from MORE is Julie Bunch and Cassie Kramer and Jennifer Earth from MAMH. We also want to thank Carol Gerard from the Massachusetts Department of Public Health, all individuals who champion access to behavioral health supports for older adults. Here's a few housekeeping notes. This is a Zoom webinar, which means attendees will be off camera. If you have questions or comments, please enter them in the Q&A box, which you will find on the bottom of your screen. Your questions will be seen only by the webinar organizers, who will share them with the presenters and the audience. Today's webinar is being recorded, so you will be sent a copy of the recording a few days after this webinar. We hope that you'll join us again on May 22nd for a conversation about nutrition. And you're going to find a link to this webinar in the Q&A. Today's focus will focus on alcohol. How much is too much and what is too much? And I am so very, very pleased to be able to introduce one of my colleagues, and that is William Stauffer, who's the director of the Pennsylvania Recovery Organization Alliance, otherwise known as PRO-A, the statewide recovery community organization in recovery for well over 3 decades. He is nationally recognized trainer and a writer on addiction and recovery. He has twice, not once, but twice, testified to the United States Senate Special Committee on Aging. And in 2019, he organized a hearing with the Pennsylvania House Human Services Committee to expand opportunities for young people. He is a past co-chair of the Public Policy Committee for Faces and Voices of Recovery, and the 2019 recipient of the Vernon Johnson Award, Individual Recovery Advocate of the Year. He teaches social work at I hope I say this right, Misericordia University, and was recently named to the Leadership Council of Foundations for Drug Policy Solutions. That is really great. It's a national do tank where he serves alongside some of the most respected leaders in the substance use disorder service system. His writings in the recovery space are viewed by many as important to consider. He's going to be using a slide deck today and doing a wonderful presentation. So let's welcome William Stauffer, or I know him as Bill Stauffer. Take it away.
Thank you, Marianne, and thank you for the warm introduction. And it's great to be here today to talk to you about this important issue. And thank you to the AARP and the whole team that has helped put this together to talk about this, as it is something that we need to do more often. First, a disclaimer. This session is intended to be informational and educational. It does not constitute medical advice, diagnosis, or treatment. You should always seek the advice of a physician or other qualified healthcare provider for diagnosis and treatment of your specific needs, for questions regarding personal health or medical conditions, and before beginning or changing any treatment, activity, programming, dietary plan. AARP and the speaker are not responsible for the consequences of decisions or actions taken in reliance upon or as a result of the information provided during this event. So we are here today again to talk about a conversation about alcohol as part of how much is too much, aging and the unique challenges older adults face when it comes to alcohol consumption. And as Marion noted, our organization is ProA. We're a recovery community organization that was founded in 1998, and we have been operating for more than 3 decades. So we have some presentation objectives today as far as this conversation about alcohol in older adults. We want to help attendees understand how alcohol is a drug and it can lead to an alcohol use disorder, and that can impact every area of a person's life. We want to have people learn how problematic alcohol use is a growing problem for older adults. We're hoping that attendees gain insight into the relationship between stigma and ageism, uh, and these challenges and how these challenges impact us, and issues make it difficult to talk about for older adults, their families, and treating professionals. And we want to make sure that you can identify resources available for helping older adults and loved ones if you or someone you know believe there's a problem with alcohol. So where we want to start with this is that alcohol is a drug of concern for older adults, and we don't always think of alcohol as a drug. We tend to forget this. It's prevalent across our society and across our lifespan. It connects to all kinds of social events and holidays, but it is a drug, and it's a drug that is a depressant. Um, we also don't often think about that. When we use alcohol, it can make us feel relaxed. It can reduce our inhibition. It can make us feel more confident as those inhibitions are relaxed. But like all drugs, there are tolerance changes with use, and we have to think about these factors when we think about its use, and we think also about the aging process. Because as we age, our tolerance tends to decrease. It's also true that medical conditions and medications that we take can impact how impaired we are when we drink. So it's important to understand this, that our relationship with alcohol may change over time and as we age. So how much is too much? Knowing your limits, drinking and healthy aging. As we age, changes to our body composition and our ability to metabolize alcohol means that alcohol affects older adults more profoundly when they drink than the same amount of alcohol, for example, would when a person is younger. There are dietary guidelines to help people think about this. To help older adults minimize risks associated with drinking, the U.S. dietary guidelines state that older adults can choose to not drink, which is always a healthy option, or two, limit intake to 2 drinks or less in a day for men and 1 drink or less in a day for women when alcohol is consumed. I want to emphasize that it is always important to consult your physician about your drinking and any kind of medication that you take, or the impact of alcohol on your changing metabolism and organ function. And I'll probably bring that up again, but this is a general guideline until you want to consult with medical professionals. So I want to start with the Woodstock kids are aging. When we're looking at alcohol use across multiple generations, we have seen an uptick in the generations that were young in the 60s, as far as both alcohol and other substances. So there's a prevalence of using more alcohol and other substances across a lifetime in ways that prior generations had not done as much. And what we have found is that these trends have continued beyond that generation, so that that have come of age after the 60s also had higher rates of alcohol consumption. And in thinking about this, what this means for people as they age is that we'll have more people who have been drinking longer across a lifespan than prior generations before the 60s. Age-related considerations. Substance use and associated problems are increasing in older adults. It's one of the reasons that I have twice testified to the US Senate is that they're noticing that these are becoming an issue across our society. So that this is something that's gaining more attention from our government because its prevalences are increasing. They were increasing before the COVID pandemic, and they have increased at a more dramatic pace as a result of COVID. They have increased also disparately in marginalized communities. So we see this, and we'll talk about this as we go, that uh, that some populations have higher rates of problems with alcohol than other communities. So age-related risk factors, older adults and alcohol. So as I noted before, changing metabolism can impact how we process alcohol. There's a higher potential for medical complications as we age, as our metabolism changes, as our kidney and liver function can change with age, as well as increased potential for medication interactions. So as these things are occurring, we definitely are encouraging people to talk to their medical professionals about their drinking and other substances that they may be taking, including prescribed medications. And it's also important to think about how we use alcohol. One of the things that we've found is that as people move into retirement, one of the reasons that people may increase their alcohol use is out of boredom or feelings of loss and isolation, things that can increase as we get older. So it's important to consider substance use on a continuum, and as we noted earlier, a decision that people can make is to not drink at all. There's also, and I'm sure you probably heard on the news that there can be some benefit for some for alcohol use, for like small amounts of wine on heart conditions and things. Alcohol use is prevalent across our society, and so non-problematic use. That people drink alcohol for social events and in gatherings, and this is something that is again prevalent across our society. It can move into harmful use, and that's where the use of the substance is causing problems across multiple life areas. This can occur either acutely when someone experiences a loss or a period of stress, and then it can also increase over time so that it's happening more prevalently across longer periods of time. People can find themselves drinking more for longer periods of time and experiencing more problematic issues with their substance use. So I'm not going to get into this slide in a very complex way, but it's important to recognize when we think about a person who may have an alcohol problem, that there's a lot of different factors that go into it. In fact, substance use disorders are really some of the more complex challenges that we face. There are biological and genetic risk factors. Sometimes alcoholism can run genetically in families. And then there are also environmental factors, exposure to substances, the prevalence of use, when people use. So things like early use and use that's often tend to increase the risk factors for a person who has an alcohol use disorder. They are also relatively common across our society, although there are things that we don't talk about, and we will discuss some of the stigma that can come from this a little bit later as well. So and this is another slide that I'm not going to go through in a deeply complex way to go over every area of the brain. But it's important to know that when a person drinks and it becomes problematic, that it affects the way that it impacts the brain. In fact, it impacts all organs of the body. But the area of the brain, one of the areas of the brain that are impacted the most are in the frontal cortex, which is where executive functioning is. So this is the reasoning centers of the brain. It's important to note this because we perhaps have known people who have had alcohol use problems, and when that happens, sometimes the decisions they're making aren't as good. And so we can look at that and wonder why they're making decisions that we might think are not rational. And it's important to note that as that's happening, it's because of the impact of alcohol can have when it becomes problematic. We want to talk a little bit about the data related to alcohol use and older adults. So the numbers I'm going to go over have to do with drinking and alcohol binge drinking, which is a kind of drinking that can be particularly problematic by age group. And it's important to note that this data comes before the pandemic, and there have been some changes in drinking patterns that occurred with the pandemic. So, and when we think about alcohol and other substance use disorders, we often think of these are as conditions affecting mostly young people. And in fact, most of our care systems focus on young people as a place to identify where there's problematic use. But if you look at the figures here, and the dark blue line is 2016, and the other line is 2017, we have started to see some upticks in older adults. And this pattern is something that we've seen across several years. So drinking is becoming problematic drinking, and binge drinking is becoming more of a condition of older adults than it had been previously. There may be a number of different reasons for this, including patterns that of the way that people are living, as well as alcohol use over a lifetime. It may be, and some speculate, that as people who were raised in an era where alcohol use was more prevalent from an early age, that the drinking continues and increases over the lifespan. So admissions. This this slide has to do with people who are going into substance use treatment, and what we're able to see by looking at this slide is the age of people as they're going into care. It also breaks this out by ethnicity. And what we can see is that there's, when I mentioned before that there are disparities, we're seeing a couple things out of these slides. One is that there's a higher prevalence of males going into services than females. And we also see higher rates of by age group, that where as people age, there are fewer people going in to care. But we'll also note that that secondary bulge in the graph there is that we are seeing an uptick in people who are over 50, and so this is also a factor. And when we think about as alcohol use disorders are becoming more prevalent, we need to make sure that there's care there for people as they age and as they need those services. One of the things that has received a lot of attention in recent years is alcohol misuse and COVID. And we're just about 4 years out from the start of the period of time when there was uh, when the pandemic impacted society, and uh, there was a sense of isolation. And what we saw is an increase in alcohol use that occurred in this era. And as we're going back and looking at the statistics of what happened, we had seen a pretty dramatic increase in alcohol-related fatalities um, around the time of the pandemic. So when we look at a 26% increase in alcohol-related mortality, that's a very dramatic change. And these changes relate to it's different across different subpopulations, and we have seen higher rates of alcohol-related mortality in some demographic groups like American Indians and Alaska Natives. Deaths tied to alcohol use also increased even more dramatically in Black Americans and Hispanics. And so when we take a look at the main stats of a 26% alcohol increase in alcohol fatalities, it doesn't really tell the whole story about what's happening, because some populations suffered significantly higher rates than that. It's also important to note that these alcohol-related deaths have extended beyond that initial data set from the beginning of the pandemic, and we're seeing it has gone down some, but we are seeing fairly high rates. So it's almost as if our alcohol-related mortality it jumped up. It's gone down a little bit, but it is our new normal is a higher rate of alcohol-related mortality than pre-pandemic. I recently saw some figures that they're expecting that alcohol-related cirrhosis will double over the next 20 years. So these are things to take fairly seriously as a society. And when we think about drinking, and I go back and reference one of the early slides, we do normalize alcohol use to the point where we don't think about it as a drug that can have a harmful impact, but it certainly is. And it's certainly something that's increasing in older adult populations. So looking forward, as it's been noted, we're going to have, uh, there are significant increases in alcohol-related deaths and binge drinking. And also, it's true we have an aging population. So we are going to see more, we're going to see more older adults. It's been projected that by the year 2060, we'll have 98 million, or nearly 1 in 4 Americans will be age 65 or older. So as we're thinking about the changing needs of our society, having services available for older adults who have problematic alcohol use, and also normalizing how we talk about it, so that if someone we love or even ourselves has a problem, that we're able to talk about it without fear of being judged. So we're going to really need to pay more attention to this. I want to talk a little bit about stigma and aging. These are complex dynamics, and in my Senate testimony, these are things that I really highlighted as major factors that we need to address. And the factors, at first there's ageism, and unfortunately in our society we do have ageism. We do not value older adults for some reason in the way that we should, and sometimes you can face discriminatory practices simply because of aging. It's also a factor that substance use there's a perception that substance use problems are things that only impact younger people. And so what that means is that healthcare professionals and others are not looking at older adults when they're looking at their medical needs and other things. they may not be considering alcohol in the same way that they would think about it if a younger person was coming in for a problem. And alcohol problems with alcohol can also look like other medical conditions. So it should be something that healthcare practitioners and others are thinking about when they're providing care. And then there's what I would call the ever-present stigma associated with substance use disorders, um, and that for some reason we've made some progress on this in what we call the recovery movement and opening up and normalizing so that people can talk about it. Um, but there is stigma, and so what happens out of this is people tend to not want to talk about if they have a problem or bring up concerns about a loved one. So we see this in a way. I would say it like this: substance use and alcohol related disorders among older adults are things that people are hesitant to talk about. They tend to occur in ways that even the healthcare professionals aren't going to talk about as much, and so they don't get addressed to the same degree that they should. Some interesting work that's been done by my organization and several others is that we ran the largest survey on healthcare related stigma in the United States. This sample size was about 25,000 for this survey across the entire United States. And what we were doing is looking for stigma around substance use in healthcare. And the reason why this is important for older adults, it's similar to other age groups, but you're not going to get help with a substance use or alcohol use disorder if you're hesitant to bring it up, or the people that are serving you don't see this as a condition like any other. So how would you? So these were questions that went to healthcare professionals across the United States and others, and so the questions had to do with how their perceptions of a person who uses drugs, and drugs included alcohol. And so the question was, how would you feel about having a person who had a problem as a neighbor? And 54% of healthcare providers said they would definitely or probably would not be willing to live next to a person who uses drugs or alcohol problematically. So there's a tendency to not be around people like that. And when the same questions were asked about for healthcare providers about working with people, they identified that roughly 57% would not want to work on the same job. And as we talked earlier about the pandemic, um, there was a lot of stress that occurred with the pandemic, and as we think about our healthcare professionals, they actually experience substance use and alcohol use disorders at about, or maybe even slightly higher rate than the general public. So this kind of stigma even impacts their capacity to seek help. We also asked about imagining persons who use drugs problematically, and that includes alcohol, about competency. And 42% of healthcare workers identified that they saw someone who uses alcohol or drugs as highly or slightly incompetent, which would mean that they don't take them as seriously. And we asked this same question in a different way. It related to how society may judge persons, and they rated their own beliefs as somewhat less stigmatizing than they perceived the larger population. What this means is that there's high rates of stigma, and it again makes it harder for people to seek help. So one of the things that we're hoping to do through this dialogue and others is to normalize this. And the reality is that alcohol use disorders are actually quite prevalent across our society. What's also true is that people do recover. Um, the good news is that people of all ages can and do recover from alcohol use disorders. That given resources and support, people can heal and have normal lives. What we do, we must ensure that we have an infrastructure in place so that these needs can be addressed across the age groups, and make sure that services are available for people who need them. And some of the things that we're doing to ensure that this takes place is to create things like organization and more, Marianne, who introduced me, so that people in recovery have places to go, and so that that people are hearing about people in recovery. Because 20 years ago, that was even less prevalent. The idea that there would be a Senate hearing, where the U.S. Senate would focus on alcohol and other substance use disorders among older adults would not have been something that occurred a generation ago. So I'm hopeful that we're normalizing some of these things in ways that had not been before. So one of the things we want to talk about is when we're thinking about alcohol use disorders and older adults and other communities, about what do we need to do, and what we want to talk about doing is noting that there's a preventative element here. There are around there are millions of Americans in recovery, and we also have older adults who are seeking meaning and purpose, and a growing proportion of older adults who need support for an alcohol or other substance use disorder. And so thinking about having connections, hope, and purpose is important. As I referenced a little bit earlier in the slides, when we were talking about the impact of the pandemic and a sense of isolation that can occur across a lifetime, uh, uh, that occurred in respect to the pandemic. It sort of highlights this thing going on in our society where people feel somewhat more disconnected. So creating places for people to experience hope, senses of community, are really important. And they're important parts of our missions at ProA, the organization that I run, as well as others across the US, to bring people together. These same kind of dynamics are things that we should be thinking about with our older adult communities, and making sure that their talents and skills, or our talents and skills, are used in ways that people feel that they have that hope, meaning, and purpose. One of the things that in the Senate testimony that I suggested is creating an older adult recovery community core, because what we also saw during the pandemic is that there were people in recovery who also didn't feel as connected, and so there were some communities that created these kinds of things, um, and what they were able to do is to reach out to other individuals who were experiencing problems, and um, there are some particular things about older adults that make it easier for someone who has a similar kind of life experience to share things with another. So we have the older adults in recovery who are seeking meaning and purpose, who really could support other older adults. But these kinds of models have been used um, in a couple different places across the U.S. and may help in a couple of ways. One, to help identify and provide support for people who do have problems, and also help people get connected before they get into those kinds of circumstances. There are places to seek help. Um, as far as in Massachusetts, if you or someone thinks you need help, the Massachusetts Substance Use Helpline, call now. It's 800-327-5050. One can text HOPE to 800-327. There's a website. Also, the Massachusetts Organization of Addiction Recovery, they have a mini guide to comprehensive recovery resources, and there's also a website that they have all of those things at. An additional resources, a resource that's available is Faces and Voices. Faces and Voices is our national recovery community organization, and they provide support across the United States for people who may feel like there's a problem or a loved one has a problem. In this respect, it's this is not something to hide. If you think that you may have a problem or someone that you love has one, it's great to reach out. It wasn't disclosed in my bio, but I'm a person in long-term recovery, and I know so many people of all age groups who have found recovery, and so one of the objectives here is to let people know about alcohol and that it can end up becoming problematic. But when it does, it's not the end of life. It can be the beginning. That there's a lot of hope once once that occurs. So, any questions that have come up so far?
Absolutely. And please, everyone, put your questions in the question and answer. We would love to get the questions, and we do have some questions for you, Bill, and this was really wonderful. You covered the gamut of prevention, treatment, recovery, all of those things. And we have one question we want to start out with is, what do you think alcohol use conditions are becoming, or I should say, why? Why do you think alcohol use conditions are becoming more prevalent for older adults? I believe you did refer to that, but let's hear about it.
It's a really great question, and I think there's a number of different reasons why that's the case. One is that our current older adult population may have been they're more familiar with substances across a lifetime. We also have more prevalence. Alcohol is more available than it has been in prior generations, um, in the way that it's available in society, and it's also one of the main risk factors for older adulthood. Can be loneliness or feeling isolated. So people can drink as for something to do or to soothe some kinds of pains. And so, that's part of the reason why we're seeing an increase. But again, it's multifaceted. I think that most things related to alcohol use disorder, there's a multiple factors. So it would be hard to pinpoint just one, but prevalence across the life cycle, um, its availability across our society, and some of the dynamics that can occur with aging and retiring, and people feeling isolated or just having an extra drink or two because they have the time.
Thank you for that. That's really, really important. Now, what can we do and you've got plenty of experience with this, is how can we advocate for more resources for this problem?
I mean, I think the first thing that we're doing is just what you're doing now is immeasurably important. Is just raising awareness to the issue. Um, but the other thing that we can do is ask, what resources are available in our community for our loved ones, and ask just like we would any other condition. We have an aging society, so we need more of everything in our society that that is that meets the needs for older adults, and that includes these services. So we want to think about how do we make them available in our community, and letting our elected officials and others know that these are things that are important to us, and that we should have them available when they're needed.
Excellent, excellent. And another question is, for older adults, how do you know what is safe for you to drink considering age-related changes and potential medication interactions?
This is a really important question. And I think one of the things that can get people into trouble is they become accustomed to say drinking a certain amount at a younger age, and it's not a problem for them. But as I noted earlier, as we age, there are changes in our metabolism. Our health can impact our ability to eliminate alcohol, and as well as the medications that we're on. So, what one of the takeaways that I think it would be most important for everyone to leave with is that this is a very what is safe for you to drink is is a very individualized number, and the very best way to learn that for yourself is to talk to your medical professionals about your medications, your health conditions, and how much you can drink given um, given your metabolism and potential interactions with medications. It's also important to note, and I'll stress once again, that it for every older adult, the amount that you can drink as you age decreases um, because of the way that aging impacts the way we metabolize alcohol. So again, it's individualized. Talk to your physician, but know that it generally will change in a way that you'll be able to drink less without impairment.
Very good. Well, thank you. That's really, really important. And here's a question, and it's a sensitive one, but just as a suggestion, and there can be many of them because there is no one rule to this, but how do you approach a loved one you think has a problem?
That is a wonderful question. I think the first thing we have to do is be willing to talk about it. And one of the biggest challenges is because because we haven't fully normalized that alcohol use conditions are prevalent across our society, and it's not, if someone has a problem, it's not a moral failing or anything like that. We tend not to talk about it. It becomes improper. Incorrectly, it kind of becomes a matter of shame when it should not be. These are conditions just like any others. So the first thing to do is be willing to talk about it and say, hey, I'm noticing that your drinking is impacting your whatever area in life that it is. It's impacting our relationship, or um, you're 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 passing out, or um, you're not spending time with ones that you love because your drinking is getting in the way. Things like that, and understand and talk about it with them in a way that is factual, caring, um, and um, in ways that know that you care about them, and that's why you're bringing it up. But the first order of business is you have to be willing to talk about it. One of our biggest challenges is that people become afraid to do so.
Yeah, absolutely, absolutely. And that approach with love is so important. So important. And without being because we don't give medical advice, but without being a doctor here, this person is asking, is 3 glasses of wine per evening considered a problem for a healthy person?
Well, if I page back to the one, and maybe I will. I'll just go back to this one. This in this slide, the U.S. dietary guidelines state that older adults generally 2 drinks or less a day for men and 1 drink or less for a day for women is what's considered within the guidelines. But again, I would really want to stress that this is highly individualized. Like it, not more, but less. Um, More is generally outside the guidelines, but this is not saying that that's safe for everyone, given your metabolism, your organ function, other meds that you were on. So 3 drinks is over that guideline for a male, like 1 drink and 2 drinks for a woman. And so that would be something to really think about. That's more than they're recommending for a person without considering all the other things.
Absolutely. Thank you for that. And you talked about the impact of excessive alcohol use on various parts of the brain. Does this affect the person only when they are actively drinking, or is there a long-term impact?
So the answer is kind of both. It can affect cognitive functioning in the short term in an acute way, but for persons who are drinking large amounts over a long period of time, particularly, it can impair functioning, brain functioning in a couple different ways, and some of those ways can actually look like other medical conditions. So if somebody is having some kind of cognitive impairment and they have been drinking a lot, it's really important to mention that to their treating medical professional because they may not be thinking of that as a factor. But alcohol use can impact brain functioning. There's a number of different conditions that occur, and so this is a factor. So you want to mention that to the medical profession, the treating medical professional, if you're particularly if you're seeing somebody who's been drinking a lot over a long period of time and there's some cognitive things going on.
Very good. Um, and I am impressed, but I want to know, what can the average person do to reduce substance use stigma and ageism?
So, so becoming more open to talk about it with friends. You, I'm going to guess every single person out there knows people in recovery, and if you become open to it and to talk about it and really normalize that recovery is very prevalent, that alcohol use disorders can also be prevalent, and to think about the fact that these are just really conditions like other ones. Um, and that's what I would recommend. Becoming more aware of that and just open to it. Because one of the problems that we've had across a generation is just sort of this unwillingness to talk about it, like it's something that we should be ashamed of, when in reality, we're talking about conditions just like any others.
Absolutely, absolutely. And along with that, letting people know there are choices as to how to go about recovery. When can you tell like the world what maybe you and I know about, but maybe some people don't know about multiple paths to recovery?
Yeah, so you know, that so there, the, a lot of people may know the like 12-step fellowships and things like that, and these are wonderful things. But one of the exciting things that are occurring across America is there's just a growing level of access to different ways for people to do things. So we have multiple pathways of recovery. There's medications that can assist people in recovery process. There are places to go like recovery centers where someone who didn't want to go to like a 12-step based meeting might try some other type of process to get into recovery. We see active recovery groups where people are doing, um, you know, meditation and yoga or hiking and things. And so, one of the things that we're learning is that recovery is a very highly individualized journey. So, if somebody's out there listening to this and maybe they've experienced a problem and they've tried one pathway, they've tried the most typical one is to go to some 12-step meetings. And for whatever reason, they found that that pathway wasn't one that worked for them. Um, I would encourage I would encourage them to try other things, look up recovery centers, look up organizations like More to find where some of those pathways are. For anybody who's trying to find recovery from an alcohol use disorder, there's a pathway that will work for them as long as they keep at it. So I would uh, provide some hope for a person in that circumstance.
Excellent. Now, here's another thing. What is, and maybe you can share with other people, a peer recovery coach, and how would an older adult go about getting a peer recovery if they chose to get a peer recovery coach?
Thank you. It's a great question. So um, in the last, there have some been innovations in substance use services, and one of the things that in the last generation we've found that's really helpful is to create these peer coach positions, peer recovery specialists who can support people in the recovery process, that they help engage people, and then help them find the kinds of support that work for them and sort of walk alongside them in their journeys. And this can be particularly helpful for an older adult, um, to navigate their way into recovery. And so these peer coaches, peer recovery specialists are, they're really all over the United States. Recovery organizations like Faces and Voices. If you're outside of Massachusetts, I would recommend contacting them, and they they're connected to organizations across the country. And if you're in Massachusetts, we have more right here that can help with that. And the contact information for them is here. So getting connected with someone that can help you walk on that journey, um, help you find your way and navigate your way into recovery and to stay in it is the main role and function of a recovery coach.
Right. Thank you so much. And because that is the, like mentioning about, we had a how much is too much about loneliness, and suffering from alcohol disorders, suffering from dependency, you can feel so alone. And a peer recovery coach is a person that can be there to be able to say, I can support you, I've been there, and as well as having gotten the training in a very, very positive way. So thank you so much for sharing on that. It's so important. If
It's a,
you were to leave people with like a nugget of a suggestion for prevention, like a sentence on a suggestion for prevention, and then a suggestion for treatment if they needed it, and a suggestion for recovery.
yeah, the suggestion for prevention is to watch the alcohol use and get involved with other things, things that you're passionate about. Stay connected to people. Do things that you're passionate about in life. Help another person, mentor someone, do some gardening, do things that have meaning to you beyond alcohol, which is sort of an easy pickup for people, but it can get you into trouble. So reducing your drinking and instead of picking up a drink, doing some other activity that that fills your soul, and that uh, provides meaning to you, um, would be that's a good preventative thing to do. Spend time with friends who are not drinking. And as far as treatment, through some of the organizations that are here, you can connect to help, like the Massachusetts Substance Use Helpline. But the same kind of things go with treatment in that, if you've tried some treatment and it didn't work for you, I would really encourage you to continue, because sometimes, just like any other medical condition, it can take some multiple tries to find something that works for you. So my nugget is really, to keep moving forward, and to keep looking for things that work for you, because recovery is really the probable outcome, if you continue on the path that you can, and millions of us have, and you will too.
Excellent, excellent. And before I forget, here's a question from the question and answer. As someone is moving on in their age, should they be drinking low alcohol drinks? What's like, is that, what do you think? Any
Um,
idea? What's the difference?
well, the alcohol content, and if you drink low alcohol content drinks, but you drink more of them, you could you could still end up with the same kind of a challenge. So, having if you drink one or two low alcohol content drinks, you're going to have less impairment, obviously, than if you drink higher alcohol content drinks. But if you drink more of them, you can still end up with the same kind of thing going on. So it's really the amount of alcohol that you take in overall, not just how many of them, if that makes sense. So It can be it can be helpful as a helpful tool to drink less in like a social setting. But if you end up drinking more of them to get the same impact, it would have defeated the purpose.
And that's a great guide to how much is too much. Absolutely. This has been wonderful, Bill. I want to thank you tremendously. We thank you tremendously. You've really helped us look at the issues of alcohol as we get older in age, where we can go, how we can get support, what we might do for prevention, how our families and friends can help us, what kinds of treatment are available, what kinds of recovery supports are available. And that is really, really wonderful. And speaking of that, in the chat, of which I can only see right now, but for others to be able to see, is the link to, as everybody's going to get, to our More mini guide. And that is on our website. All you have to do is www./more-recovery/org mini guide. And nationally, go to Faces and Voices of Recovery. All you have to do is use that old word, Google it, and you will get there in an absolute positive way. And we want to really thank AARP. Please check out the AARP events and go to www.aarp./local. And you can also go to www.aarp.org VCC. And everybody, you got to know this, is that you're going to get a recording of this webinar within 3 business days, and we will include the slides too. There will also be a short survey in the follow-up email. We hope that this was a good use of your time and was valuable for you. And we want to say thank you again to Bill, as well as to Kara Cohen from AARP, Julie Bunch from More, Cassie Kramer, and Jennifer Earth from MAMH. So, as well as the Department of Public Health. Thank you so much. And we'll leave it there. And we hope everybody's going to get really excited about getting a video of this event. So thank you so much. And be well, everyone.
Thank you.
And that's never too much, to be well, everyone. Very good.